should not have agreed to follow up because I can't follow up on that. But we do have some really exciting things coming up next year. We are working to more closely partner with MGMA next year for joint meetings again. In January, we're planning on having a joint meeting with NACI Memphis, our Memphis NACI. So excited about that. Working with HFMA to get some joint meetings there. So we've got a lot of really good things coming up next year. Next month is our CEO Roundtable. We will be meeting, normally we meet at the FedEx Institute for Technology. However, it's under renovation right now, so we're going to be meeting over at the Garrett Auditorium at Baptist Memphis. So grateful to them for opening that up to us. Rather than me rattling off some canned comments that I've gathered from LinkedIn and other profiles, I'm going to let the speakers introduce themselves. And once we go through the questions for the conversation, we will have some time for Q&A. So please be thinking about that. And since we just have the one microphone, I'll be running the microphone back and forth, I think like I did last time we had a joint meeting. But once again, I'm so grateful for everyone being here, and I look forward to another great panel.
Hello everyone, I'm going to be moderating our panel this afternoon. I'm Corinne Kennedy and I cover healthcare and economic development at the Commercial Appeal.
Hi, good afternoon. I'm Kristen Bland. I am the Corporate Director of Government Relations and Regulatory Affairs for Memphis Savannah Healthcare.
Hi, I'm Rob Clark, Chief Government Affairs Officer at St. Jude Children's Research Hospital.
Hello, I'm Keith Norman. I'm Vice President of Government Relations and Chief Community Relations Officer for Baptist Memorial Healthcare.
Are we loud enough if we talk to you like this instead of, yeah? Okay, great. I think we're all used to, yeah. Okay. All used to projecting.
So I'll get us started. So Keith, I'd like to go to you first with this question. What are the outstanding public policy issues that are of most concern to you and to your organization today? And what do you think are some public policy issues that may help or threaten healthcare organizations most?
Okay, well thank you, and thank you for inviting us and having this opportunity. Everybody's facing labor challenges right now, I think across the systems. Baptist is found in 3 states, and so I can tell you in Mississippi, Arkansas, and Tennessee, one of our problems, or one of the things that we're challenged with the most, is labor. But when you boil it down to policy, some of the things that are undermining our ability to really succeed at the mission of what we're trying to do is provide health care for the least fortunate in some of those communities. There are other things that are out there as well. A rising issue I think all of us need to pay attention to is cybersecurity and how it's coming up on the radar and how we need to pay attention to that. And then we also have to think about physician payment models and cuts. There's a 3.75% Medicare cut that's proposed for 2022 that's going to happen, that's not going to roll back. There's the recoupment payments of 340B, which helps so many of our hospitals to provide the drugs that we need to the people who are in our care. And with the new changes in policy that are coming out of Medicare right now, we realize that the pharmaceutical companies are probably going to move the needle. They're going to raise the prices on some other things that we may have need of while we're going through this process of protecting some drugs. They're going to look at other ones that they can raise the price on. So there's some stability issues out there that we have to look at. I think cybersecurity, I think labor is going to be a very important thing. Physician pay cuts, that 3.75 is going to be high on the radar. Effective payment models, all of those things are things that Kirsten, myself, and Rob are always trying to play whack-a-mole. You hit this one on the head, by the time you go over and hit this one, another one pops up. And so you have to watch for all of them all the time.
That's great, Keith. I can't disagree with any of those. When you talk about policy issues that are important to St. Jude, when I'm talking to stakeholders, I always like to remind them about a couple of things that really make St. Jude unique, and therefore really is the lens through which we look at policy, opportunities, and challenges. So first of all is our mission. We're a pediatric hospital, and we're an NCI designated cancer center. So we don't have an emergency department. We don't offer a full array of services for our kids like our wonderful colleagues at Methodist Bonner do. Our mission is very narrow. We're focused on catastrophic childhood diseases. Cancer, about 75% of our research and treatment portfolio, but sickle cell disease, infectious diseases, other things round that out. So our mission is driven by the vision of our founder, Danny Thomas, that no child should die in the dawn of life. So everything we do is again focused through that lens. And the second thing that makes us unique is our business model. So no child, no patient, no family ever receives a bill. If they have insurance, we'll recover. If they have TennCare or Medicaid from another state, we will recover that, or if they have private insurance. So unlike, again, my colleagues that probably focus a lot more on Medicaid payment models, physician reimbursement models, that's not at the top of our list. Really the things that I get up every day and look at in our team at St. Jude, it involves biomedical research, translational research, and the federal investment in the National Institute of Health is really the driver for innovation in biomedical science in this country, really the world. The U.S., thanks to the foresight of, I don't care what administration has been in office since probably the Nixon years when we launched the war on cancer, every Congress, every administration has been fully supportive of a federal investment in biomedical research, which we have reaped the benefit of that as a country. One thing that I'll say that concerns me, and this is as we're coming out of this pandemic, I've noticed this at primarily the state level, and that's a lot more skepticism about vaccines. And I'm not talking about just COVID vaccines, I'm talking about well child vaccines. These are the vaccines that have kept our kids well, since, we, all these pertussis and all polio and all these dreaded diseases, we don't have to worry about that because of vaccines. But because of skepticism that has bubbled up, primarily due to the pandemic, we've seen a decrease in the rates of well child vaccine, which is very concerning to us as a children's hospital. So I think that's a public policy, it's a public health issue. And for us, it hits home because infectious diseases is such an important part of what we do, research and treatment. But our cancer patients are so susceptible to infection because their immune systems are compromised. So I would say, that's a number one issue for us.
Great. Sir, can you all hear us, or would you like for us to use this mic? Microphone. Okay. We will go with the consensus. Okay. So I'll keep my remarks brief because they've covered it pretty well. One thing that you can count on is healthcare. Just healthcare everywhere. We all have very similar issues, but I will echo what Keith said. Workforce is our #1 issue. I know you read about it in the media. If you work in hospitals, you feel it. At Methodist Bonner Healthcare, I can tell you in 2019, in terms of RNs, we needed maybe 369 nurses. We would recruit, that's kind of an average number. Earlier this year, 2022, we need 900 nurses in our facility. We are lacking. It creates a challenge for us to operate, as many of you know. So Keith and I talk a lot to our elected officials about the issue of workforce. It's not like healthcare workers are going to come down from heaven, as much as Keith prays over all of us. There has to be a pipeline. There has to be training. It's going to take some time, right? And of course, Memphis, Tennessee is probably not the #1 recruitment area of choice at the moment. When you can go and make more money in New York City, California, places further up north, right? So definitely workforce for us.
And so you make a good point of raising awareness for Memphis and West Tennessee. And even on a state level, that can be tricky, getting people in Nashville to remember that we have wants and needs here in Memphis. So what do you think, are some of the issues that are affecting your local stakeholders the most? And what are you guys really focused on? And Kristen, I'll go back to you first and then we can go down.
Yeah, sure, absolutely. Number one, thank you for asking that question. So I'll take that as two-pronged. Sometimes in Memphis, West Tennessee area, you can kind of feel like a stepchild, to Capitol Hill. And I would say in that regard, when you're making a case, you either find issues that are unique to Memphis and West Tennessee, or you find things that you have in common, right? You can focus on those two issues. Rob mentioned how St. Jude is unique. They are a unique institution. We are lucky to have St. Jude. And Le Bonheur Children's Hospital is very lucky to be able to partner. We share our doctors. We share our surgeons. We are the #1 neuro science program in the United States. People come to Memphis for their children to have neurosurgeries here. It's unique. It's something that Rob and I can partner on. It's something that we can talk together on. So that is important when you are advocating, right? Where can you find partnerships, common links, things of that sort. So the second half of that question is, what are you and your organization most focused on today? I would say what's happening outside of our hospital walls right now. As of today, not just today, but this year, the number one issue killing our children and our teens is gun violence. Memphis has always been on the top 10 for crime. We've always had issues here in Memphis, but it's not just a Memphis issue anymore. It's nationwide. It's what we're finding. At Le Bonheur, we're now looking at 120 gunshot victims that come through our door. When you're short-staffed, that's a huge issue. Not only are you looking at life-saving techniques for these children that are coming through our doors, but you're looking at them probably having long-term life treatments. So our community health needs assessment is something that we have to do as a hospital system per the 2010 Patient Protection Act. All right, so every 3 years, our hospitals have to do that. Keith's Baptist Hospital has just done that. I believe maybe St. Jude has to do that as well. But our numbers just came in this fall, and they're staggering. In Memphis, Black males are 8 times more likely to die of gun violence. All right? Black children under the age of 18 are 11 times more likely to die of gun violence. That's not right. When we talk about disparities, when we talk about inequities, that's a huge deal. And so, is it something that healthcare that is just a hospital issue? No. And Corinne and I were talking about this earlier. It's a community issue. It's going to take community solutions and us partnering together to really work towards it. We have these round tables of discussion, and you say something like gun violence. Everyone's eyes gets really big and says, what can we do about that? And it's not, and I'm glad to hear the we in that, because it's not something that any of our institutions can do alone. It's something that is going to take all of us. So I'm glad that we're partnering, and you have MGMA, you have ACHE. These are the things that we need to be talking about. So thank you for the question.
Thanks, Kristen. Yeah, I would echo really the public safety perception, and I think when you talk about a community that we all love. I'm not from Memphis originally. I grew up in Atlanta, but I ended up in Memphis to work after grad school, and have been here ever since. Helped raise both my kids here in Memphis. So yes, part of a healthy relationship is being able to be honest in your self-examination. And when you look at Memphis, yeah, we've got issues, but I'll tell you what, we've got a lot going for us in Memphis. Excellent quality of life. I mean, so many wonderful things, and I think over the last 8 years of the Strickland administration, we've really moved in the right direction in terms of enhancing our parks. We've got wonderful redevelopment of Tom Lee Park that's going to be opening next year. I mean, these are the types of things that really can change the narrative. And when it comes down to it, I'm serving under my third CEO at St. Jude, and every single one of them, when you ask them what's your biggest worry, what's your biggest challenge when you get up every day, it's recruiting talent. Recruiting talent, the top talent from around the country to come to Memphis and come and live here. And honestly, when we've recruited top scientists from East Coast, West Coast, they may have had some trepidation about moving to Memphis initially, but once they get here, it's like they love it. It's like they are able to peel back the onion that we all see every day. But the issue of public safety and how do we address at-risk youth. I participated in a panel that the Chamber sponsored earlier this week. And we heard about a great and potentially transformative program that Youth Villages is piloting called Switch. And it really identifies and puts together a team of life coaches, social workers, other folks who, after we identify a youth who perhaps, they haven't had a role model growing up, and so they're out in the world basically functioning on their own, and what are they going to do? They're going to turn to crime in many aspects, and they're going to return to gangs and groups that influence them that, if they'd had those positive role models that I had, Pastor Norman had, that Kristen had when we were growing up, you're able to push that aside and move forward. But unfortunately, we have a lot of youth in our community that need help with that, and I think that's where we're going to need to target a lot of our public policy issues.
So I'll take that question and break it up into smaller slices of the same conversation. I'm going to work from the bottom up. What are the issues West Tennessee for? I want you to think about these numbers. In Tennessee, poverty is about 14.6%, and it came down just a smidget to about 13.8% statewide. But of that 13.8%, 7.2% is concentrated in West Tennessee. So I want you to get the vastness of that number. And much of that is in Shelby County, okay? So some of the poorest people in the state are concentrated in the rural areas of West Tennessee and in Shelby County, making health care a real hard nut to crack. And without expansion, without addressing those issues, it leads to other systemic things. That's where the violence comes in. That's where the extreme poverty takes hold of people's lives. Mental health, especially in Shelby County, especially in this area, we don't have enough beds to really treat the people who walk into the EDs that Kirsten's hospital and my hospital see. Most of the people who come in don't really have a physical health issue. They have a mental health issue. And what we did for many years was that once they came to the hospital, we did what we could do. Many of them wound up not of our doing, but because the streets were calling them back, they ended up at 201 Poplar. And so, we've got to address the mental health conundrum that exists in West Tennessee and provide some support and some care in that particular area. I always say, and this is a conversation I had with a group last night, Memphis is a tale of two cities. On one side, you have this extreme wealth and voluminous philanthropy. People give. But on the other side, you have vast poverty and people need. And as long as we have philanthropy that doesn't address the issue, the poverty will always exist. So we have to have some real good conversations, and some tough conversations about why these things exist. And when we start seeing health as wealth, that's when we begin to make the needle move the most. So I think that's one of our major issues in this area.
so, you know, and Rob, I'll have you take this next question first. When we talk about advocacy and exerting the type of influence to solve these issues, how can individuals who maybe don't have the same influence, aren't in the same positions as the three of you know, be able to influence these topics we're talking about? You know, what works? We see email campaigns, social media, we know, but, you know, what do you guys think works when, you know, average people want to help influence these issues?
Elect Rob as your spokesperson and make him write all of the letters, because they're not gonna hurt St. Jude. They'll get back at me in person. That's what we do.
Yeah, that's a great question, Corinne, and I get asked that question a lot by folks who want to get involved. And you know, I think it starts. I think it just starts with having an interest in the issues, learning about the issue, so that you become informed, and then going and sitting down one-on-one with your elected official, whether it starts with your city council member, your county commission member, state representative or senator, your U.S. Representative and senators. These folks actually really like when constituents come and talk to them with an issue, and it's much more effective than writing a letter or sending an email. And of course, it takes more time. It's, you know, it's more of an investment on our part when we do that. But I can tell you that the impact is so much more. You get so much more out of it than, you know, if you're just communicating that way. And I think that's, to me, has always been the first step. And I can point to, you know, some really important policy changes that have been made because of those sort of one-on-one interactions. When you have a compelling story to tell and you're willing to put yourself out there to tell it, you'd be amazed at how often people want to respond to help you with that. Now, I'm not going to, you know, it doesn't work all the time, and oftentimes it takes many, many years to effectuate a change in a particular policy that you're interested in. But I can tell you that it won't change if you don't make that effort to get involved at a personal level.
I would say the same thing. Your elected officials want to hear from you. And it really is as easy as sending them an email. You know, a lot of people, I think, these days are electronic, but a face-to-face meeting, let them hear your voice. Not only, you know, literally hear your voice, but go sit with them, have a conversation with them. But I really do think that finding something you're passionate about, if it's healthcare, great. If it's something that you have a personal interest in, you know, talk to them about it. They want to know about it. They want to hear about it. I would also say in terms of resources, you know, at the federal level, I like Politico. Read their newsletters if you're interested in public policy, politics, things of that sort. You know, TV like CNN or Fox can slant things depending on, you know, where you land. So look for credible, you know, sources. At the U.S. News and World Report, they have a series called Healthcare for Tomorrow, where they have webinars and, you know, and articles and things of that sort, where you can just keep yourself, you know, up to date. And the HHS also has the Office of Intergovernmental Affairs and External Affairs. You want to know what we're talking about, what we're thinking about, what we're talking to our elected officials about? Go to that website. There are all the list of advocacy issues on there. We're probably having those kinds of conversations in our roundtables discussions. On a state level, sometimes what happens in Memphis transcends across the state. Sometimes it doesn't. Sometimes it's just unique to us. So all politics are local, right? So in terms of locality, like, you live here, you know what's going on here. What are you passionate about? Get involved, all right? I mean, just ask the questions. On a state level, I like the Sycamore Institute in terms of policy. They have some great information. that, also is credible and there's no slant to it politically. And I like the Tennessee Journal too. If y'all know about the Tennessee Journal, you can hear from a lot of the elected officials and what they're thinking about on those issues.
So, let me see, I'll frame this way. I grew up as an only child, and so I spent a lot of time imagining, thinking, creating friends. I got rid of them, but a lot of times you have to help elected officials understand the unintended consequences of a bill. Thinking about what is not clear. For instance, 2 things in Tennessee. Guns for everyone, anywhere, anytime, any place. Really? And that's not good. It's just absolutely, come on, think about it. And even though, you're not in the hospital, how do you really stop that from happening? And then when you talk about some real things that we know, let's talk about some of the issues in our community. Let's talk about some of the issues that are happening around maternity and that guy who's angry, who comes to the hospital and the girlfriend's having, and there's a gun in there. We've had that happen in our hospitals. These are real scenarios, real stories. So there are unintended consequences of bills when people are thinking one way, they're not really seeing the impact in our industry and what can happen to us. And you really have to sit down and not be afraid to say those things. It's tough. And you have to call it out and you really have to put it online. There was another bill, and the writer, one of the writers was Representative Gillespie, and I'm glad, I wish he were here, I commend him on this. He was writing the bill, and one of the things I wanted to share with him was that here's some of the unintended consequences, because I know Memphis pretty well. So people who commit a crime within a certain radius of a hospital could end up going to jail and serving the full sentence of time, right? But there's a little park right across the street from Methodist where some guys just sit over there and play basketball, or right there by Regional 1. If you're driving down, I think it's Popcorn, right over there on the left. I said, those guys don't bother anybody. I'm a Memphian, I knew that. I said, they're not bothering anybody. I said, and we don't want those guys to go to jail forever because they're outside arguing over who hit the last shot, because they're in a certain proximity of a hospital. So he really did change the language of that, but not being as familiar with that location as I was, he needed someone to bring that to his attention. And so oftentimes what we do is we try to bring things to the legislative body's attention to say, here's some ways of thinking about that, and here's some ways that you need to think about unintended consequences of what could happen if that bill passes in its current form. This is where you get a lot of amendments, you get a lot of language change, and you get a little legislative, up and down the hill with it. That happens on every level. It happens locally, it happens state, it happens federally. You have to really keep weighing in on it. We're weighing in on some bills on the federal level right now that we hope will change, not the bill and make it go away, but just to change the language so that the outcome will be better.
Well, then, Kristen, you already touched on this next question I'm going to ask a little bit. So I'm sure everyone here is an avid reader of the commercial appeal, and if you're not,
You can talk to me later about subscribing. But where do you go? What resources do you use to stay up to date on these policy issues that matter to your organizations?
Well, I rambled off a few different ones, but honestly, I work in the hospital. We live it, every single day. We're hearing it in our meetings. We're hearing our statistics for workforce, our 340B issues. Resources are great, but like I said, most politics are local. What's going to happen is happening here, and being a voice to federal, state, and local elected officials is really key. And I would say, my role wasn't really around. I was, 20 years ago. And so now, if you go into a hospital, they most likely have a government relations person. We probably know them, you know, but I would say when I came into my line of work at Methodist Water Healthcare, it was fairly new to, not very many hospitals had government relations and government affairs folks. But today, you really can't get a leg up as a hospital, rural or urban, system or independent facility, without having some kind of advocate for your hospital, likely doing the work that we're doing. And I think oftentimes in terms of resources, it's you all, you know, in our hospitals doing the work. We need to hear, you know, from you all. The statistics I rambled off in terms of workforce, it's through our human resources department, you know, who tell us we really need help. You know, we almost need 1,000 nurses, RNs, to help with, you know, fill our hospitals again, so that we can take care of our volumes that we were taking care of pre-COVID. So I would say that y'all are a great resource here on the ground. And then all those that I rambled off, last question.
Yeah. So I'll share with you my algorithm each day when I go start my day. Again, we've got a great resource with the CA. That's where I start. Then I hop over to the Daily Memphi, and Bill Dries who covers local politics, issues. And then I like to go to the Flyer because our old friend Jackson Baker, the veteran, he really he comes up with some gems, and he keeps his finger on the pulse. And so you just never know what Jackson's going to share. He's out and about a lot. Memphis Business Journal, if you're looking for more in-depth coverage. I hop over to Nashville, Tennessee, and it's owned by Gannett, which is the same as Commercial Appeal. So you get a lot of the same content, but again, more of a Nashville centric focus. The Nashville Post is very good on the political side, and then Kristen mentioned the Tennessee Journal, which publishes weekly. It's a 4-page newsletter format. They really get into the nitty-gritty. If you want to know about what's behind the scenes, who's doing what to whom, and everything about it in politics, get the Tennessee Journal. But they update content on their website throughout the week, so you know I hop over to that. And then I go over to Chattanooga, the Times Free Press. Mm-hmm. That's an independent owner, and Andy Scher, who's been a long-time Capitol Hill reporter, has great content. And again, it's a little bit of a different focus from Chattanooga. Then I go nationally, Washington Post, New York Times, LA Times, and then I go more to the trades, which we've talked about some of those modern healthcare. A lot of you are looking at that content. Bloomberg, we use Bloomberg at St. Jude for our government affairs shop. That helps us track legislation not only nationally but at the state level. That's invaluable resource for us. Politico, Kristen mentioned, is another great one at the DC level. And you know, so again, I'm reading for about an hour and a half as I start my day if I don't have anything, you know, that I've got to pressing take care of. But I like to just stay on top of what's going on and see the different perspectives. And I read far right, I read far left, in addition to the ones I just shared with you, because again, unless you understand their perspective and where they're coming from, you can't, you know, that you're missing something. And so, although I may not agree with one side, how they run a story or how they report it, it's informative for me in the policy world to understand why they're coming from that position.
So I think all of the locals have been covered. I agree with all of those. I'm going to add one or add a couple for areas that concern me to really get down, to drill down to the core, social determinants of health and other things of that effect. I'm going to look and see what NACI is writing about and where they are publishing or where their thoughts are. NACI, well, there's a NACI local chair sitting right there, and there's actually National Association of Health Service Executives. And so it's an organization that's primarily concerned with African American and minority issues. And so they'll cut straight to those things. Becker's is also good. I love to read what Becker's is saying for systems of hospitals. But y'all gonna beat me up when I say this, but if you Google this guy in Mississippi called Kingfish, and has anybody ever heard of it? You ever heard of it? Always on point. I never misses. And I don't know where this guy gets his inside information. I don't even know what his real name is, to be honest with you. He's an underground journalist kind of guy. But when he's talking about issues in Mississippi in healthcare, where we're the largest provider of healthcare in Mississippi, he's spot on. He knows who's going to do what's happening 2 days before it comes out in the newspaper, and he's right most of the time. There are also other places. The American Journal of Public Health, that's a good one for me. The Lancet is another one. These publications come out, and you're not going to find yourself reading them cover to cover, but there are policy sections within them that can help you when it comes to staying on top of what's happening. And I think every now and then, in order to really get a real compass for things, you've got to go outside the United States. There's an international journal, because if we only compare ourselves to ourselves, then we really don't have any innovative thinking that comes forward. There's an international journal on public health where systems around the globe often do things. They have innovative practices that from time to time we try to mirror in the United States, but we don't quite get the full concept of it. But you kind of see where it comes from. So I think reading all of those things are always helpful. But I couldn't deny any of the ones that have been spoken already. They're all excellent. And the commercial appeals to lead. Right.
I think we'll go to Q&A now. Scott's going to run the mic for us.
So before we begin, Parker Harris will be passing out evaluation forms. This is something specific to ACHE, but if you would mind, our MGMA brother and sister, if you wouldn't mind completing that as well, that'll help us to make sure we stay on point and continue to bring valuable programs. So Q&A, I'll run the back real quick.
Good afternoon. My name is Sheena Freeman. I am with Regional One Health as well as Nazi Memphis Chapter President. One of the questions I have for the panel, with CMS new rules with social determinants of health, making sure that we are capturing those things, what recommendations do you all have to ensure that we're capturing that effectively? And as Keith indicated, there are a lot of systemic things that are taking place in our community. So what recommendations do you all have to ensure that the hospitals are prepared for those changes that are coming in 2023?
So that is a great question. I'm going to ask if I can start on it, because it falls in my area. I'm Vice President of Government Relations and also Chief Community Relations Officer, and the CHNA falls up under my work. And so I have one part of my team that's saying, from the government perspective and quality and so forth, we got all these new rules coming out, and we have on the other side of our team people who said, here's some things we've known all the time. One of the things that we have always kind of known in hospitals is that social determinants of health are actually drivers and determine how some people come in and come out of the hospital. Some people don't get the same treatment. There's a lot of things that are happening. Whether that is intentional or not, it's not the issue any longer. What the new administration, President Biden, saw coming into his term was the social determinants of health were just, the gap was widening. It was just growing wider and wider and wider. We did our own search of our system, and although it did not come out on the same level as some of the national numbers, we were actually better in most cases. It still existed in every situation. So we could honestly evaluate ourselves and say, we can't give ourselves a passing grade and say, look, we're not on the radar here. And so there will need to be in every system, in everybody's healthcare system, a person in charge of that particular thing. There will need to be a written plan that deals with at least 3 and seeks to solve one of those particular issues. And given the size of your system, it's probably good to get together and start talking about what's in your area and what can we collaborate on and what can we do together and how can we get resources. You're going to need to know things like this. When a person is in a hospital bed and they're being prepared for dismissal and we're letting them go, if they don't have utilities on at the house, we're gonna have to figure out how to help them at least get to the resource. You may not have to pay the bill, but you gotta figure out how to tell them. And so there are resources that you can put on your website, but that also means that some people who are at the bedside will need to have a manner for detecting those things and determining those things, and some sense of, you know, social worker kind of skills in order to help facilitate that process. And so that's a challenge, and I mean, we're right around the corner from it. And I think it has to be something that you fully own and you really go for it and say, we gotta solve this problem. Probably we could learn a lot from St. Jude, because I think St. Jude is probably doing most of this stuff already. I mean, from the point that they check a patient in, I've had members of the congregation that I serve whom had children at St. Jude, and you know, when they walked in the door, they helped to support some of those things from day one. They didn't wait until they left. They were saying, hey, we want to make sure you're good and stable through this entire process. So it's going to be a challenge, and we've got to put our arms around it. Excellent, excellent question.
Yeah, and I would just, I'd like to give a shout out to my colleague, Jane Raymond here, who heads up our community health needs assessment process. I mean, that's something we all do in the healthcare world, but it's even more important that we get that right. And we have to do that as a hospital, and also, as I mentioned, we're an NCI designated cancer center, so we have to have a robust community outreach and education component in order to be accredited by the NCI to be a comprehensive cancer center. So we're looking at that from a lot of angles, and as Pastor Norman has said, I mean, St. Jude by design, that is what we do, right? When you come to us because your child has cancer or sickle cell anemia or another dreaded disease, fortunately we have the resources, thanks to 11 million active donors from around the country, to wrap our arms around that family and just enable them to focus on getting better and going through the very rigorous treatment process that you have to do to get to the other side. Now, what we have noticed, once a child ages out at age 18 and they're moving into the community, that's where we've noticed where some of these folks just drop out of the system. And particularly for some of our local sickle cell patients who were treated, and again, they've got every resource that they need to stay on their treatment regimen and protocol. But once they become adults and they are out in the community, they may not be as attendant to doing what they're supposed to do. Some of that has to do with other social determinants that are beyond their control. And so we've begun partnering with adult providers, you know, in the community through Regional 1, through Methodist and Baptist, to try to form our own safety net around these folks and help them to make sure they continue to get the care that they need.
I don't want to belabor the point, but I will say that I do realize that not everyone here works in healthcare. So just to make sure that everybody knows what social determinants of health are areas such as, you know, transportation, housing, poverty, those elements where we take as essentials getting from point A to point B and allows us access into a healthcare system. Those are social determinants of health. What CMS and JCO, there are two versions, you probably know this, and they're calling it health equity. So that's a big umbrella, something, you know, they're very focused on disparities and collecting what they're calling real data, REAL, all right? Race, ethnicity, and language, all right? And then they keep going and drilling down a little bit deeper. But they're really trying to put an impetus on hospital systems, focusing on the disparities in their communities and how we can help. And your question is great, and I think that, you know, from what I understand, JCO you'll have to start reporting and collecting data as of next year. If you don't go through JACO accreditation, like for instance, Methodist Cabana Healthcare, we do DNB. And so we're looking at the CMS requirement. So they're a little bit different. There's a variation there. But I think that we're all working. We all collect this data currently, right? But we also have to have champions. Doing our CHNA, our Community Health Needs Assessment every 3 years, I think the federal government is saying that's not enough. We need to be doing something on a daily basis to be taking care of these daily issues in our communities. So thank you for the question.
Yeah. Yes.
Hey, thanks y'all for being here. I'm Clint Cummins, CEO of the Memphis Medical Society, and get to live at least part-time in that underbelly of politics, official healthcare term, right? Part comment, part question. One of the things that we observe all the time is, whether we like it or not, money plays such an important part in this, and particularly I'm talking about contributions to politicians. We all got to play that game, right? And I think kind of going to some of Keith's comments, that is sometimes how you gain visibility, but even that sometimes is not enough. So that's part of my comment, is we need to do more of that in our community. Is I'll refer to them as door prizes, like we gave away today. You know, when you get that time with that legislator that you all referred to earlier, you know, we're not saying you got to give thousands of dollars to these folks, but when they give you their time and give you their attention, it is good to make a contribution to their campaign, because we want them to continue to be reelected, and we want them to continue to, you know, some of them go poor in order to try to get elected in their position. So that's an important part of it. Having said all that, after you've given the money and given all the support that you can give them, how do you deal with stupid? Because everybody having a gun in their hand is stupid, and I apologize if that's a political statement, but it's stupid. There are members of my family that don't deserve to have a gun in their hand, and there are some other laws and things in this state and in our country that are backwards. So how do you process that, particularly through the lens of Memphis, when you go to Nashville, or when you're having a conversation and you know it's not going anywhere? Like, how do you still, you know, is it just put your nose in the grindstone and keep going, or are there other strategies you're employing to keep yourself visible, even though you know you're in a losing battle? Sorry, that was a mouthful of a question.
No,
That's a fair question. And, you know, I would start by saying, like, everyone's politics is different, right? I mean, let's just start with COVID. I mean, going to Thanksgiving during COVID, if you went to Thanksgiving during COVID, I mean, maybe half your family wears a mask, half of them weren't, everybody had an opinion. I mean, it's everything. I think politics touches everything. But I think you're talking about, how do you have hard conversations? First of all, what I would suggest is, when you do contribute to an elected official, whether it be like personally, or maybe perhaps through your organization, like your PAC, you know, when you go and you have that conversation, when you deliver that check, I'm sure a lot of us like to deliver the check personally, so that we have a face-to-face, and they know who you are, and they've got eyes on you, right? They won't forget you. And so when you do that, and when you deliver the check, you're not just saying, oh, here you go, but you're saying, I'd really like to have a conversation about what's important, you know, to me and my organization, so that they understand your position, number one. So there's a critical conversation that needs to happen when you're contributing. And they need to know what your expectation is of them. It's kind of a two-way street. The second thing I would say on that is, you can't deny data. So let's just take your example on guns, right? I know that in Shelby County, the Memphis Police Department lobbied very, very heavily at, you know, the state capitol to carve out Shelby County because of our crime rates, because of what goes on here. Didn't happen, but they went out there, they advocated, they made their case, right? What did I open with? Our gun violence is now the #1, and in Shelby County, our statistics are ridiculous. Our pediatric population, 120 victims, under the age of 18 that have already come into the Le Bonheur ED. I think that you collect data. You can't deny data and what's going on. You have respectful conversations, smart conversations, and where you can partner, you do. Whether it's on a national front, statewide, or local. So that, because if you contribute, and if ACHE contributes, and MGMA contributes, and the American Hospital Association contributes, and we're all talking, on the same thing, and we're sharing the data with them, that's kind of undeniable. So stay smart, stay updated, and provide them with good information.
And I'll just add one thing to Colleen, as you mentioned, first your comment of the impact of money. There's no question money plays an important role in the political calculus. One could argue an inordinate role, but that's a topic for another day. But so many hospitals have their own political action committees, 501c4, in the IRS tax code that allows you to donate money. St. Jude, we don't have a PAC. We do utilize and we make individual contributions to the Tennessee Hospital Association's Political Action Committee. I serve on the board of that Political Action Committee, so there's a group of us that gets together to determine, okay, the PAC's going to give money to X, Y, and Z because they support us, and we're not giving to A, B, and C because we don't like their position on that. So that process, that's an important part of the policy making process because you have to support financially those that you want to keep in office.
So I'm going to take the back side of the question first. How do you deal with stupid? I employ the Rupert Murdoch rule, which is to give them very little attention. Don't give them a banner headline. If you saw one of Murdoch's papers the other day, he said, Florida man announces bid for presidency at the bottom of the paper. Never named who the person was, didn't put it on the front cover, just said Florida man announces for president. I think we make some of the outliers the headline when we really know that they're being way out there. There were some, and the way I'm going with this conversation is this. Kirsten's been how long at Methodist?
18 years.
18 years. Rob? 21, 10 for me, and on the board of Regional 1 before that. But we will outlast many of them. And I'll tell you why. We had a guy in East Tennessee, and I won't mention his name, I'll mention his replacement, and our colleagues know who it is. If it was a healthcare policy, you had to give him money, he was gonna talk crazy to you, he was gonna say, I'm not voting for it. And now he's replaced by a guy named Dr. Richard Briggs, who is clear on health policy, even though he may be in the Republican Party that didn't pass certain bills that we needed. He's open to discuss things, and he lobbies in the right area. So when you get into these political, don't make a war out of an issue, number one. Don't make a war out of it. Because oftentimes, we're gonna be here, and we're gonna keep on advocating, and we're gonna keep on pushing for what's good and what's right. But when you make a war out of it, and you make it the headline, you become the casualty of war for the moment versus and let's keep the issue as the main thing. We have been fighting for expansion in Tennessee for how many years now? Since 2009, right? But guess what? It's at the top of our agenda again. We're gonna fight for it again. And slowly but surely, we're finding people who were against it in rural areas, some who were not on board. They're having a moment where they sit up and they kind of go, oh yeah, we did take $1 billion worth of COVID dollars from the federal government. So why wouldn't we take $1 billion in expansion dollars from the federal government? And so the reasoning is coming around a little bit more. Politics swings back and forth. You get tea parties today, You get people who are way over here, and then a few years later, they'll go and right themselves and go, no, we don't want to be that extreme. We'll come back to the middle a little bit. Advocates have to stay right there and continue to push for what's good and right. And don't give them a headline, just put it right at the bottom.
We have time for one last question.
Al Da Silva with Da Silva Consulting. My question is related to the nursing shortage. I am a registered nurse myself and have worked the bedside for 10 years. What is being done to understand why nurses are leaving the profession? And what is being done to actually prevent them from going to New York, LA, Atlanta, in our own city? So that's my question.
Start with you, Rob.
Great question, Al. You know, I'm a reformed hospital administrator, so I started my career out on the operations side. And so it seems like for as long as I've been in healthcare, which is coming up on 35 years, we've always had shortage issues of one kind or another, one profession or another. I mean, I can remember having to use agency nurses when I was running a little hospital in North Mississippi. We haven't figured out the answer to that question yet. And it seems like it's part of the larger labor issue that I think it's more acute now after coming out of the pandemic, because so many people's work habits changed and so many new opportunities became available that just people had not even given consideration for working in. There's a lot more flexibility, and so I think that hurts those of us who have to find people that have to be on site from X hour to Y hour. You know, you can't work from home to take care of a patient in a hospital bed. So I think, you know, in our free market economy, it's going to have to come down. The wages and benefits are going to have to go up in order to attract and retain, in my opinion. Again, if I had the answer, I'd be, you know, a gazillionaire.
Yeah. So what we have seen coming out of COVID is the heightening of the impact of travel nurses on the industry. Travel nurses have been around all the time, but during COVID, it was exasperated. I mean, it just went up a notch. And so the big question became, why don't you just pay your nurses more? And in reality, when you go and find the studies that really support it, that wasn't the only thing, and it's not the only thing, because it's leveling out now. Hospital systems all over the country are figuring out, okay, now that we don't need travel nurses, things are kind of pulling back a little bit, and we're not using them as much, and we're not going to pay as much, and so forth. Stressful work conditions and environments where they're not appreciated and valued were at the top of the list. People, just like you and me, in the jobs we're at, we want to be at places where we are appreciated. And periodically, you just want your workplace to show that they see you and that they are concerned and that they are doing the best that they can do to alleviate some of the stressful conditions, as well as increase at a continuing basis the rates of pay. One of the things that I did, and we in community relations during COVID, so, you know, we started getting people in restaurants who wanted to do something because, you know, we don't have customers right now. So I had all of these vendors who had food. And so I had my team to go out and pick up food from the restaurants, and we paid them, and we brought it to the nurses in the hospital. And our nurses just thought, you know, this is the greatest thing in the world. You all are bringing, and food that they had never had before. We went to some soul food restaurants that they had never been able to visit. And they started asking me, can you bring some of this so I can take it home to my family? And then we thought about that. They're working longer hours. What if we did bring something? So it was a value proposition more than just a dollar proposition. And we let them know we're thinking about you, we care, and you make difference. I think that's anywhere. I think it's among nurses especially. That's where we're seeing the biggest impact right now. And then my only other problem, since this is the last question, I gotta get one dig in against my friend. Methodists hired all my nurses away. No, I'm just kidding.
I wish we could go get your nurses, okay? I would say that you've got also generational issues. You had the Great Resignation, with lots of nurses who exited, when COVID hit, they were exasperated. They were the veterans. They were the ones that were coaching alongside the new nurses who had just come out of nursing school, and they were seeing deaths every single day. They were not used to that. That's not what their training prepared them for. Our veteran nurses were ready to retire, and they were part of that Great Resignation. I would also say that we have a national crisis when it comes to a decrease in the number of enrollments going to university, much less going into what we would call like healthcare, caring for others. Younger generations, it's not really for them. I'm gonna take care of me and my family, and I've realized since COVID that I can work from home. I can be much more flexible. When you're a nurse, you can't work from home. You've got to show up every single day. The hours are long. You got to be passionate about what you want to do every single day and care for them. It is, as you all know, I mean, it comes from the heart. You're not going to change out somebody's bedpan because, it's a nice thing to do. It's because you're there to do your job every single day and you're going to show up. So I would say that we have generational issues, and just as Keith said, you want to be somewhere where you're appreciated. And I think that as hospital systems, we can be better. There's lots of hospital violence. We talked about gun violence. Hospital violence has increased also in terms of patients attacking their healthcare providers. We've got issues internally there. Who wants to work in a place like that? Not only are you not appreciated, but you're having to deal with issues like that. It's tough, and you probably know how tough it is. What we're trying to do about it was your second question. Everything we can. When you talk about advocacy, we are advocating. When we say that workforce is our number one issue, it is definitely our number one issue. We can't operate. As a system, we have these constant recurrent conversations around the table at work is, we're an urban center. We have dense populations. We have our community. We have lots of poverty. We have lots of needs, all right? When you talk about rural hospitals too, where are the folks from in rural communities going? They're coming to us. Yeah. They're really not going to rural hospitals. They're very few and far between. Methodist Atlanta Healthcare had a hospital in Fayette County many years ago. We had 1 to 2 patients a year. They would travel to Methodist Germantown, Methodist South, Methodist North, wherever they needed to go. They wouldn't stay in the rural communities. Right. So what's going to happen to those rural hospitals that are out there when you have operational issues? You don't have enough nurses. It's all coming. It's all coming. And so we're really trying to do everything that we can. We all wish we had better answers for you right now, but maybe next year, if you invite us back again, maybe we can have some better.
So there's one other thing I'd like to add. In my other day job, I serve as a pastor, and I did a panel discussion very similar to this regarding healthcare and theology, this whole idea of caring for people. And there is data that points to the toll of trauma and how much trauma can any person withstand in a compressed amount of time. One of the things I recall during the height of the pandemic at our hospital was being called from the corporate office to come over and pray with doctors and nurses. I'm not a chaplain at the hospital, but they were saying, we need you to come over here because people who were expected to live were dying. I remember one day very clearly, we had a young girl who came in at 30 years of age and presented, and before the end of the day, she was gone. And the impact that it had on the doctors and the nurses, especially the nurses though, it was devastating. And so there is this thing that we have been experiencing in the last few years, which is the toll of trauma that weighs heavily on healthcare professionals and how it is being dealt with. And then when you add that, violence is taking place. We're seeing more gunshot wounds in Shelby County. We're seeing children shot by guns and coming into our hospitals and healthcare systems. We're seeing so many different things. I think that is a small percentage of why you see the Great Resignation. And then the social work advocacy that is being humped onto or poured onto the nurses. They got to discern a lot at the bedside in order to really be effective at what they're doing because of the new rules and things that are coming down the pipe. So it's a lot happening that contributes to that.
Well, thank you so much to the panel. I just want to extend our gratitude once again to you all for taking time out of your busy day to come and share your insights with us. Thank you everyone for attending today. Just leave the surveys on your table. I'll pick those up. Also, for MHCE members, this is something new to us. The meeting was recorded. It will be posted, and I will make sure that we send out a link to where that's at. For future meetings, we are looking into, and this may be news to some of our board, we, meaning me, looking forward to utilizing this in future meetings. ACHE will grant us qualified credits for those who couldn't be in person who watched the video. So that's something else that we're going to be adding next year. Once again, thank you everyone for coming. Is there anything else?
Yeah, that's right. We're having a Christmas party December 5th at the Medical Society. Looking for emails for information to come. Thank you all for being here.
Thank you everyone. Have a good day.